The influenza season started about 4 weeks earlier than usual, and more people are getting infected with more severe illness. Around 5,000 deaths have already been reported in the United States due to this influenza. And usually it is caused by influenza A virus, subtype H3N2. This strain previously caused the Hong Kong flu pandemic 50 years ago, historically known as Hong Kong virus. But today's virus is slightly different. It is a different subclade, and it's called Super K. This is more severe than previous years. The virus spreads easily. It causes more serious disease. That's why we will talk about it. Its signs, symptoms, how to protect ourselves, and how to treat it effectively. The infection usually starts about 1 day after exposure. You are most often infected through respiratory droplets from other person during talking, coughing, sneezing, especially in closed spaces with poor ventilation. Transmission also happens through hands when you don't wash and then touch your eyes, nose, and mouth. Symptoms typically begin around 1 day later. Even before full symptoms appear, many people feel unpleasant sensation, unusual fatigue, and heavy body sensation, cold intolerance, a mild headache, reduced appetite, and a clear intuition that something is coming. This early phase happens because the cytokine release, mainly interleukin-6 and interferons. After several hours, the illness declares itself. In most cases, there is sudden fever with severe chills, explosive fatigue, muscle and joint pain, and headache typically felt behind the eyes. On the second day, the fever usually continues and weakness becomes crushing. There is diffuse muscle pain, sometimes a severe headache, light sensitivity, and profound exhaustion. This toxic feeling is caused by high cytokine load. Dry mouth, mild cough, and chest discomfort are possible but not dominant at this stage. After about 2 days, respiratory symptoms become more noticeable. The person develops a dry, painful cough, a burning sensation in the chest, sore throat, and voice hoarseness. The nose is often congested. After the third day, the fever usually decreases or subsides, but the cough intensifies. Days 5 to 7 are critical differentiation phase. In uncomplicated cases, the fever is gone, appetite slowly returns, the cough persists, and weakness remains noticeable. In the complication-prone course, about 30% of cases, the fever returns, the cough worsens, shortness of breath increases, and chest pain appears. This is when pneumonia or bronchitis declares itself. Recovery from this infection is often prolonged, sometimes lasting up to weeks, with persistent fatigue. The person experiences exercise intolerance, a dry cough, and brain fog. Many describe it, "I'm not sick, but I'm not normal either." Now let's look at how influenza differs from other viral infections. With influenza, nasal congestion, sneezing, or runny nose are not primary features. Fever and severe fatigue are the dominant symptoms. In the common cold, symptoms develop gradually, not abruptly like influenza. The illness usually starts with runny nose or sore throat. Nasal congestion, runny nose, and sneezing almost always present, while fever is rare, possible, but usually low grade, usually below 38 degrees Celsius. High fever is not characteristic of common cold. Respiratory syncytial virus is also common cause of respiratory-related symptoms, and it is characterized by persistent cough, chest tightness, wheezing, or mild fever. In young children, it is one of the most common causes of wheezing, feeding difficulties, or dyspnea cases. There is no prominent muscle pain, no sudden fever, and progression is slow. The cough can persist for weeks. For COVID-19, there is slow onset compared to influenza. Fatigue, sore throat, and dry cough are common. Loss of smell and taste remains relatively specific. There is no severe muscle pain and no abrupt hit-by-truck onset. Symptoms evolve over several days, and recovery usually occurs within 3 weeks. Now let's talk about treatment of influenza. The first and most important step is strict bed rest because it reduces metabolic demand and cytokine stress. Rest alone can reduce symptom severity around 30% of cases. Adequate hydration is critical. Warm fluids also like soups, broths, and teas are especially important because they improve mucociliary clearance, soothe the throat, and relieve symptoms, with noticeable improvement in about 30% of cases. Honey for adults only, 1 teaspoon has anti-cough effect and reduce cough frequency by around 30%. Honey must never be used in children under the 1 year of age. Steam inhalation helps moisturize the airways and ease coughing because humidified air prevents airway dryness and can reduce cough severity around 20%. Another way to support your immune system is vitamin C, about 500 milligrams per day or 500 milligrams 2 times per day. Zinc lozenges started within 24 hours also can be helpful. They reduce viral replication in the upper airways. Zinc works best for the common cold, but it also effective in influenza. Ginger tea has anti-inflammatory and anti-nausea effect. It can ease nausea and soothe the throat around 30% of cases. Lukewarm sponging for fever help with heat dissipation without triggering shivering. Prioritize sleep and avoid alcohol because alcohol suppresses immune system function. Avoid smoking and secondhand smoking because they inflame bronchial epithelium. Nasal saline spray can help clear secretion and reduce viral load in the nasal passages. Honey with lemon at night can reduce cough frequency and soothe the throat discomfort. When it comes to medication, oseltamivir, a neuraminidase inhibitor, is effective if started within 48 hours of symptom onset. It can shorten symptom duration up to 2 days and reduce the risk of hospitalization by nearly 40%. Zanamivir, an inhaled antiviral, is effective. It's alternative to oseltamivir but should be avoided in people with asthma or chronic lung disease. Veloxavir marboxil is a single-dose antiviral option. Also, it is effective but less studied in elderly population. For fever, paracetamol or ibuprofen are effective. For respiratory help, oxygen therapy sometimes can be life-saving. Bronchodilators are used in asthma cases and in elderly population with obstructive pulmonary disease. And chest imaging should be done when cough is worsening, shortness of breath appear, fever persists, and it helps detect pneumonia early. Antibiotics should be used when there is bacterial superinfection, but never routinely. Hospitalization is recommended for people with severe symptoms, age 65 and older, hypoxia, dehydration, and altered mental status. For prevention, vaccination is crucial. It reduces risk of severe disease around 60% and lowers influenza-related mortality around 70%.